My name is Natalie, and I wanted to take the time to tell you my cancer story. So, in December of 2016, after having a seizure while I was eating, I was rushed to a nearby hospital and a CT scan was done, and it was told to me that I had edema or swelling in this part of my brain, and they didn't have any further equipment to do testing on me, so I was sent via ambulance to another hospital in a neighboring city. An MRI was done, and I wouldn't get the test until the next day, so I practiced my best Arnold Schwarzenegger. It's not a tumor, and the next day I was told it was a tumor. So plans were made for my surgery, which happened in January of 2017. And because the location of my tumor, which is in the speech and motor function area of my brain, only a little bit could be taken out, about a pea-sized amount. And this is detrimental to me because the whole tumor can't be taken out. I just have to live with it. I did do 2 rounds of oral chemotherapy treatment, and I did do 1 round of radiation treatment, which is actually what made my hair fall out and not the chemotherapy. So within about a year's time, I went from having a shaved head to pretty long hair, not this long, but about this long. So I was pretty happy about that, even though at the time it didn't feel like my hair was ever going to grow back in. So that was pretty awesome. In talking to my oncologist, though, I was pretty saddened when he told me I had about 14 years to live, and then he, I guess, tried to boost me back up by saying, but science is always evolving, which I understand, but when you tell somebody they have about 14 years to live, it's kind of it's devastating. So brain tumors they have 4 levels. So level 1 are typically benign. Some can be malignant. Mine is a level 2 tumor, so I got pretty lucky on that one, even though mine is malignant. And it's basically cancerous, in other words. So what I have are called partial seizures. So that go along with this. Seizures can range. Usually people think of seizures as very debilitating. People fall to the ground. They don't know what's happened. Whereas with mine, my diagnosis came after I had 1 seizure while I was eating in December of 2016. And every time I've had a seizure since then, it's been when I was eating ever since, except for 1 seizure, which is when I was really, really stressed out. And you'll tell throughout this video, sometimes I get stuck on my words, and that's because of where my tumor's located, and I just sometimes get tongue-tied. So basically what happens is I'll feel an expanding feeling in my jaw right here, just on the right side, and I know that a seizure's coming. So if I'm with somebody, I can tell them I'm having a seizure, and my jaw will just flex and flex and flex and flex right here, and then after that flexing is over with, I won't be able to speak. And then when I can speak again, my speech is very slurred. So when I had my initial seizure, I couldn't speak for a while, and I had a very hard time after I could speak again to get my words out, like the number 3. I got really stuck on it. Like I would say 3. It would be very difficult for me to say that. As of right now, I've seen a couple of different neurologists to try to get me on different anti-seizure medicines. I've been on up to 4 different medications. I'm actually on to seeing a 3rd neurologist because the first 2 just didn't work out for me. 1 pushed me and my appointment's out 6 months, so that's not really good when you're trying to get your medications on a good level for yourself, and the other one just completely ignored me at every turn. Every appointment I had, didn't really listen to me, and 1 medication that he prescribed to me, I let him know that on that medication, I was having suicidal ideations and he completely ignored me. So I eventually told him, how do I titrate myself off this medication? He told me how, and I got off of that, and he told me how to go back up on another dose of another medication I was on. And with all the medications I was taking, it made me become really lethargic and tired and listless, and I started to gain weight, and I was just giving me this really depressed feeling, and I just kind of spiraled downward, and just the weight gain was just really hard on me. So you really have to make sure with your doctors that you stand your ground and you advocate for yourself, and if there's something that you don't feel is right, you need to tell them, and make sure, like in my case, if you are giving them that paperwork that came with your medication and you're saying, hey, I'm having about 98% of these symptoms and they're not listening, it's time to move on, most likely. So that's what I did. So I'm about to see a third neurologist, so hopefully the third time's the charm. I currently am not working because the medications I'm on cause me such bad tremors that I can't do what I'm licensed to do vocationally. So I am a makeup artist and a esthetician licensed, and my hands tremor so poorly that I can't even hardly put my own makeup on sometimes. My eyeliner gets so goofy that I have to correct it. So I'm not even about to take a chance on a client and mess their eyeliner up or something like that. And I have a hard time eating, keeping the food on my fork or my spoon, that when I eat at the house, I have to keep my plate up to my face and my fork here just to make sure that either it gets on my mouth or gets on my plate. But of course I can't do that in public, and I had to go to a birthday party today and I just was awkwardly eating because I was hoping it got on the plate, and my hands were tremoring so bad that I was just hoping that someone wouldn't sit up and ask me why my hands were shaking. So it can be a little bit embarrassing sometimes when you're in public and trying to work through some of that stuff. If I'm wearing a button-down shirt or a button-down coat, it's hard to get the buttons through the holes sometimes for me. And it's hard, but I try to maintain a positive attitude because I just think that's the better way to be. I joke around a lot about it, and you know, people think sometimes I'm crass about having a brain tumor and brain cancer, but you know, I've always been somebody to joke around, even though it's a hard situation. It kind of breaks the ice when you're maybe in a fight with somebody or whatever the situation is, but you know, I have to take it one day at a time. Just every day I thank God that he gave me another day, and I just have to be grateful for what I do have, and you know, just keep fighting every single day. And I, within this past week, had another cancer scare, and I went to get my annual done at my gynecologist's office, and it came back with some abnormal cells, and I had to end up getting a colposcopy done and a biopsy, 2 biopsies actually, and then waited for the results, and they came back, said that abnormal cells should go away within a year. There's no cancer, nothing like that, nothing escalated in the results. So I was very thankful for that as well. I said, well, I was ready to fight again, but I'm glad I don't have to fight any more than I already do. So I'm just pushing through here and just trying to stay positive. So if y'all have any questions about anything, my story, anything you're going through, send me a message, shoot any questions down below. I'll do a follow-up video for you, and I really appreciate you watching this. Thanks.